So the first question I think that comes to many people's minds that have diabetes is that, am I really at increased risk for having heart attacks? Because most people die when their heart stops, and that's kind of how we make the diagnosis of death. So if you look back in my practice when I started 20 years ago, I rarely saw in the operating room people that were heavy. Most people I saw were smokers, they were thin, and they were 60 some age. Now what I see is young people that are in their 30s that are very, very heavy, and they've had heart attacks, and some don't even know they've had them yet. And the problem is the fuel lines that run to the human heart, there's three. In diabetes, you're equivalent to having heart disease already, because by the time that you get diagnosed, you have already increased your atherogenosis all over your body. All your blood vessels are starting to fill up with atherosclerosis, probably 10 to 15 years before that. So by the time that I see you, from an interventional cardiologist point of view, to fix what is in your heart, understand that from head to toe, the other 60,000 miles is also plugged up. But we're real good with the heart because we spend a lot of money researching the heart. But at the same time, understand that what we see in the heart goes for what's in your body, from your head, including your brain, all the way down to your toes as far as blood supply. So if you plug up your heart, the chances are you're also plugging up the rest of your body in different places. So it's just a matter of time until you have problems. To follow up on those comments, people know that the heart does have heart failure sometimes in some patients. How does a person with diabetes develop heart failure? Well, the heart failure comes from a lack of blood supply to the muscle of the heart, which is probably the most common for people with diabetes. That means they've lost the blood to one part of their muscle, so it dies. So the power of your heart, which used to be 37 horsepower, now runs at maybe 20 horsepower. You used to be able to get around and exercise, but now you're somewhat limited. That's because you've damaged your heart, and that piece of muscle looks like a piece of gristle in a steak. It does not contract. So when you start to exercise, you do not have the performance that you would expect to see out of this heart that's so wonderfully put together. So in order to protect that, you need to think early and preventatively. It is too late, and the horse is out of the barn. By the time you see us in the operating room, I cannot repair anything other than a small part of your blood vessels. The rest of the blood vessels, just like your heart, you will live with the rest of your life. It's like a car. You chose to take care of it early and change the oil as expected, or do you wait till you put 200,000 miles on it and say, guess I'll change the oil now? You still have to drive the same car most of the time, but for sure you're in the same body for the rest of your life.